Let's talk about asymmetry. I often have patients come in and they're worried about asymmetries that they can see in the mirror or potentially ones that they've been told they have by other practitioners, like their hips are uneven or their legs are different length, things like that. So let's talk about some things related to asymmetry. First, we're actually not very symmetrical. We're only really symmetrical at a very superficial level. So we're roughly symmetrical with, two eyes, two legs, two arms. But the closer you look, the more asymmetry you will see. We're also asymmetrical in terms of our function, right? The two hemispheres of the brain control different things. Organs on each side of the body are different. The vasculature has a different structure on each side of the body. So lots of asymmetry. Second, not only is asymmetry normal, but it is even adaptive in some cases, meaning it is better to be asymmetrical in certain cases, or it is a result of being better at something. So, sports, anytime you're throwing or swinging something, you can guarantee that there's going to be some asymmetry in your strength and range of motion between your two sides or between the different directions. So asymmetry should be expected, and it can also be of great benefit. Third, asymmetry is not a mechanism of injury. You have to do something to get injured. So just having different leg lengths or having hips that have different ranges of motion doesn't explain why you're in pain anyway. Asymmetry might predispose you to injury with repetitive use or with sudden trauma, but neither of those are because of the asymmetry. They're because of the trauma or the repetitive use. And even then, research actually doesn't even support asymmetry being a major risk factor for injury, except post-surgery, but that still isn't the asymmetry that's doing the work. It's the loss of muscle and strength in the leg or the limb that was injured. And the asymmetry is a proxy measure for getting the limb back to its original strength. So, if you're worried about asymmetry because you don't like how it looks, that's fine. You can definitely work on that if you want.